the outside. Good evening to each one of you. Coming to sexuality in general, we have a lot of anxieties. And among men and women, if you have to look at it, female sexuality is something which actually many people don't talk about it. Hardly, in fact, worthwhile work has happened, at least in our SORC areas. And much of it, actually, what we have is anecdotal experiences too, in fact, what we can say, copied from the West. We started working on this particular field for quite some time, and at least there are about 4 major MD theses, one PhD, plus few more other things. Actually, has actually opened our eyes to a great extent what is really happening in this particular area. There are a few conflicts of interest in the beginning itself, I should mention, because as a man, how much I am rightfully placed to actually talk on female sexuality. I belong to the opposite sex. It is possible that I may be interpreting things slightly wrongly. I am husband, father, son, and I have seen my mother, my wife, my daughter, and quite a few other colleagues. In fact, I might have been interacting in some way, and actually, whether it actually conveys the specific meaning. Psychiatry and sexology have a very direct connection, and indirectly too, there are a lot of things impinges upon each one of these things. In certain areas, what I am trying to do is actually to make it simple. We can understand things easily, and actually whatever we learn, better we learn with open mind, and so also not to take it each of these aspects too seriously. I make, in fact, say some anecdotal experiences too. In fact, one or two jokes may come. Please take it as the face value. We are still learning. This is one of the very difficult areas, and it is actually a never-ending process of learning. Just like there are so many life lessons are there. We are all well aware of the statement by Osho that woman is one of the most beautiful phenomenon in the world, not to be compared with anything else. The woman is the masterpiece of gold. In fact, God, that's what actually he had mentioned. And we are all aware what we are talking in general may not be applicable to all the people. There will be some exceptions. There will be something which actually doesn't fit in. And it all depends on who is trying to look at this particular problem and from that particular angle. As a doctor, as a psychologist, as a family member, or as a man, see, each of our interpretations related to woman would actually be something totally different. And we need to actually be specific about what women were maybe about 5 decades ago, 2 decades ago. Recently, wonderful changes have happened. In fact, I almost always say the revolutions have happened as far as the female sexuality is concerned. One revolution was when oral contraceptives came into being, which liberated the woman from what they call clutches of getting pregnant with each and every aspect. Then subsequently, HIV, the time we started talking about sex. In fact, universities talk sex. This is one of the major programs which was running in India for a long time. Then subsequently, what we are all well aware, when sildenafil citrate came, in fact, it actually solved all the women's problem. I still remember one of the major study which came after sildenafil citrate was introduced 1 year later, covering 2,000 plus couples from China. It spoke that hardly anything has changed as far as the women are concerned. What it means is man can get an erection, but women's sexual needs are something actually quite different. Now we are seeing arrival of internet, the mobile, and the mobility related to, in fact, the scooty, so many other things, have liberated women from the shackles, many of those things which actually would preventing women from dealing with their life properly. So what we are seeing is a remarkable changes as far as the female sexuality is concerned. And we need to have a certain aspects, open mind, and understand what changes. women are going haywire, and lot many other such comments some of the people may be actually talking about. And when we are talking about female sexuality, you must almost always have some comparative points related to men and women. People say we are all 50-50. We are same. We are really same, or actually there is something called we are different. There are many such aspects are actually one can look into. And this particular presentation, I have tailored it in such a way that, in fact, female sexuality, all of these things be spoken in about an hour's session is not actually possible humanly. So few of those things which are clinically important and which has to be kept in mind when female life, and we have to deal with the case. So there are few areas which are very clear cut, and those particular areas where we have a little bit of evidence. I'm not going into quoting a lot of references and all of that. For all practical purposes, if somebody is interested, there are plenty of literature available as far as issues are concerned. What I'm going to do will be a little bird's eye view of few of the things what we can actually understand from our point of view. The first slide I have put is actually the Science of Women's Sexuality, which appeared in Newsweek. What it actually spoke was, see, the drugs which actually act so well in case of man, hardly it acts in that particular fashion in case of woman. Why actually this particular difference? And when we try to look at, there are a lot of areas where there are commonalities there. One is, say, when we are trying to talk about arousal and orgasm, the orgasmic contraction is 0.8 per second approximately, and even G-spot ejaculation they have documented. In both, it is same. But to reach that particular point, for man, it is very easy. For a woman, it is a very circuitous route. What actually is that? We'll try to look into. In the same fashion, what I will be trying to look at today is actually men and their behaviors are quite different from actually women. Men are more likely to be exhibitionists, fetishists, and pedophiles. Women wear a very revealing dress and all. In fact, may understand that we are talking whether women are more exhibitionists and all like that. But all studied and world literature speaks about men being actually more exhibitionists than actually the females. Pornography, in fact, women's interest would be something totally different. In fact, the romance and lot many other such as soft related issues too. In fact, the men who basically, in fact, most likely to go with what we basically call hard porn. Men get bored with sex very fast. Hence, promiscuity strategy and a whole lot of issues related to that. And the last three, significant passivity, what one can talk about, the sexual drive related issues and behavior. I'll start my presentation from the last one, the 7, behavior and female passivity. From that particular angle, it's a very relevant, important point. Why actually, in fact, handling female sexual problems, there are different types of what we basically call sensitivity one should have and actually has to proceed.
To my ever-loving wife, during the last year, I have attempted to make love to you 365 times. I succeeded 36 times. This averages once every 10 days, and the following is a list of reasons why I did not succeed. It's too hot, 15 times. It's too cold. I'm too tired, 19 times. It's too late, 16 times. It's too early, 9 times. Pretending to sleep, 35 times. I'm not in the mood, 21 times. Mind my hair, 28 times. Is that all you think about? 83 times.
What it means is, in fact, one of the joke what I can say is there was a group, one Italian, one African, one American, and one Indian. Italian says, when I have sex, I burn almost around 700 calories. American says, I burn almost around 900 calories. African says, I burn almost 1,200 calories. Indian says, I burn 2,000 calories just to make her agree. No, you got a point. Somehow, this particular issue, not being taken seriously, and there is actually a whole lot of issues related to. What I am actually trying to convey is when you are trying to talk about female sexuality, the drive significantly inhibited for whole range of things. It has to break this. This is one of the extremely important component necessary for understanding. If you try to look at, say, for example, this particular figure, this is a overall general idea to give. What it actually talks about is at any particular given age, man's libido or drive is actually significantly higher compared to the females. This has implications related to what should be the age difference between man and woman and some of those type of things. I'll come 1 or 2 minutes later. Sexual drive, when we are trying to talk about, in case of male, it is aggressive and testosterone dependent. Orgasm intercourse are inevitably linked. Socially acceptable, enjoy, lustful, and want sex is actually taken for granted as a part and parcel of growing up. Upbringing actually contributes to this particular idea. And this is what, ultimately, because of this, men want more sex. They are likely to have more partners, have more sexual dysfunction as they age. But when you are trying to talk about female sex drive is actually passive, receptive. Why? In fact, there are a lot of explanations are given. In fact, some more we can add positively. Intercourse and intense pleasure are not linked. Unlike in case of man, they are very, very closely linked. And ejaculation and orgasm, in fact, both are linked so commonly that what happens between the legs and what happens between the 2 ears, they are so clearly actually matched. But in case of female, it is not so. For many, difficult to achieve orgasm. Less sexual frustration and a lot of issues related to sentimentality, romance, relationship, and these are all actually which cost quite a bit for the females. Traditional societies in general, they discourage. And maybe, in fact, in the what we call certain African other countries, we are all well aware of clitoridectomy, and lot many other things. Because, in fact, the pleasure is one actually, which is actually problematic to the woman, inverted commas. For them, it is duty than joyous and pleasurable thing. And influence of hormones, that actually creates quite a bit of difficulties. This is the reason why desire for sex more often linked to relationship status and social norms. At all ages, women more likely to report sexual dysfunction. And this is one of the reasons why, in fact, however beautiful wife may be, the others look actually significantly more interesting. And there is only perfect wife in the world, and never every neighbor has it. This is one of the very common focal statement. And in the same fashion, men get bored very frequently. That's what actually we spoke. And in fact, the affairs and lot many other things are extremely commonly reported in case of male sex. Coolidge effect, where 30th president, while traveling in one of the bonds where they come near, the bond keeper says this particular rooster screws almost 100 chicks per day. In fact, the madam's party is there in the front, and this is what actually told to the madam. Madam says, please tell this to the Mr. President. When Mr. President's entourage comes near, the bond keeper says that this is what actually madam wanted it to be conveyed, that this particular rooster can screw 100 chicks per day. President only one response. Is the same chick or different chicks? This is what precisely, I mean, to make such an amount of difference in the two male and female, actually what we're talking about. So inhibited female sexual behavior is actually something predominantly there, and there are other different components we will be trying to look into. To understand female behavior, see, this is one of the very typical picture how actually a man sits. In fact, a little more exhibition is actually what we basically were talking about. In the same fashion, woman primary predominantly actually under lock and key, protecting oneself, saving oneself is actually appears to be one of the major common things. But I have almost about 1,000 plus pictures which actually depicts the different types of behaviors. So what typically a man sits and what typically a woman sits. Women almost under lock and key. In fact, explanations are many. Whether it is actually found only in less sophisticated models, celebrities, and other related people, how actually they sit and present themselves. In fact, I could go through, in fact, this is from the two recent magazines. Each of these pictures says protecting oneself is one of the very typical story. And you look at, in fact, any number of pictures we can document, almost always under lock and key. This is one of the very typical story. And to understand this clinical importance, as and I proceed in about a minute, I'll come back. In case of man, actually getting stimulation is extremely easy because all erotic tissues are concentrated at one particular place. You give him PDE5 inhibitors, it acts at one particular level, and in fact, he can get the response. Either masturbation or any stimulation, in fact, is extremely easy for the man. But in case of woman, the erogenous zones are distributed so far and wide that, in fact, a lot of effort need to be put actually for actually what we basically call purposes of stimulation.
लड़कियों का प्लेजर पॉइंट कहाँ पड़ेगा? घीस पर जाने का है ना, मैं बता दूं। यहाँ से बिल्कुल सीधा जाए, इधर ही है, सीधा आएगा अपना वजीना नगर पे टोल आएगा, उधर ऐसे अपना पर्सनालिटी कंसेंट विंसेंट डेट वेट लेने का, उसके बाद आएगा छोटा लाबिया गेट, वहाँ पे बहुत संभाल के चलाने का है, बहुत शुक्रिया। फिर फैलोपियन फ्लाईओवर अगर आगे ना तो तू बहुत आगे निकल गया है, तो वहीं पे गाड़ी घुमा के थोड़ा ऊपर नीचे आगे पीछे that's spot right there keep it going yes oh yes मतलब फिर बारिश होगी तो समझ के पहुंच गया। तो वजीना नगर से स्ट्रेट बस। ये लड़कों का प्लेजर पॉइंट कहाँ पड़ेगा? मैडम यहाँ से सीधा जाने का एक बिल्डिंग पड़ेगा, एक ही बिल्डिंग, बुर्ज खलीफा टाइप। बिल्डिंग से कहाँ? कहीं नहीं, उधर ही आसपास कहीं भी, कुछ करने का भी नहीं, सिर्फ सोचो, फुल घनाघन बिल्डिंग। I know.
So there is a wide difference between actually man and woman. And there is another one small, in fact, these are all actually good learning experiences from that angle. Closing eyes. Extremely important. In fact, one of the joke is that women close their eyes because they don't want to see man enjoying. But all said and done, in fact, there is a whole lot of things. For a woman to actually experience pleasure, she needs to concentrate without diversion. And this is extremely important. Even animal experiments have proved this beyond. Under lock and key. In fact, this I still remember my mother had given a little bit of eggs and some food to two small puppies. When they grew up, this male fellow will, when even if door is closed and gate is locked, jumps the compound wall, meets his friends and comes back. This female, in fact, dog, when it has grown up, it is there inside the compound only. This is one of the very typical story. So, women closing eyes and many of these type of things, what has been reported is actually to this particular idea that they have to concentrate. And in the peak of sexual arousal also, a woman may be worried about whether the child's bag is ready or breakfast has been, how actually what need to be prepared and many other such other things, which distracts. And this is one of the reasons they find it very difficult. Men invariably keeps their eyes wide open mainly because, of course, I jokingly always say to look into who is coming next. So the point of discussion here is actually the erogenic tissues are distributed far and wide. Unless she concentrates and focuses on, it is not possible for her to reach orgasm. This is one of the reasons why when we are trying to talk about therapy, just giving a medicine is not going to answer their questions. And where the range of therapies, including what we call touch therapies, the sensate focus and lot many things, they are extremely important components for understanding female sexuality. Brain mechanisms. In fact, the male brain is in fact about maybe 100 to 200 ml bigger than actually a woman's. But what actually has been compared is that this is like a desktop. Woman's brain is like a laptop, same but better, bigger capacity, well connected, and it can work extremely well. Women really have smaller brains, but they use them better than men. This is one of the statement what actually very clearly makes the point. And in the same fashion, in the same line, if you try to look at, there are not many other things. Men invariably think in terms of sex. Say, take an example. Many women complain that this is the only thing what I think of all the time is actually attributed to this particular fact. You look at certain aspects in the male brain, which explains few more additional points. You look at, say, for example, sexual pursuits, very well developed in case of male brain. Territorial defense, fear and aggression, very well developed in case of male compared to females. Alarm system, which drives emotional spheres. In fact, very well developed in this case of man. Motivation center, seeking partner is actually extremely well developed. All of these things, what they convey is there are few things very well developed in case of man, but what actually women are expecting, those things are actually missing. In fact, the worry ward, fear of punishment, performance anxiety, well developed in case of females, but not so well developed in case of males. Inhibitory system, very well developed in case of females. Pain circuit, pleasure and mourning. In the same line, in fact, the empathy related aspects, whether we are talking about cognitive empathy or emotional empathy, both are so well developed in case of females, but not so well actually in case of males. Social approval and disapproval, in fact, which is a rostral cingulate zone, very well developed in case of females, but not so. Why I am actually telling this is, let me just come back to, in fact, when we are trying to talk about female brain, queen of emotions, prefrontal cortex, breaks on amygdala, large mature, and it is very well developed in case of women. Amygdala, wild beast, what we talk, very well developed in case of man, but so not so well. Hormones, pituitary gland, and a whole lot of issues related to that. Gut feelings. In fact, processes which actually, in fact, many of the women are considered as lie detector machines. Very easily they can make out what are actually the changes that are happening. Hormonal symphony. And more than anything else, the worry ward. See, when we talk about man, for him to actually fantasize, imagine actually extremely easy. But in case of woman, leading to what we basically call significant guilt and other related things. And this is one of the reasons why the fantasy, so well documented beneficial in case of man, has not been found that much more common. Hippocampus. In fact, this is one of the things actually what I would like to tell. Many of the times, it never forgets and what we basically call good things and even bad things. Anything actually has happened, they carry forward. In fact, almost women have been compared to computer because once it is there, it is actually stored. Comparing oneself, expecting cognitive empathy, social approval, these are all so well done. Whatever happened in the beginning, in fact, the thing is, they actually stored very well and maybe the first case, must holding hand and many of these type of things. And they never forget. And they fight romantic, in fact, tender moments, fight, romantic, other things, what we can talk about. And they won't let you forget us. I think somebody's, I have driven somebody to sleep. They won't let you forget us. This is one of the reasons, in fact, some of these things are carried forward so much time. And unless you set this right, as far as the relationship issues and other related things, you can never continue with the treatment properly. And one should almost always keep it in mind. From psychiatrist's perspective, we are better placed for in managing female sexuality, mainly because we are capable of actually spending time for counseling, spending time for history taking, and many of these type of things. When we are trying to talk about female sexuality, women get actually really perturbed by some of the male issues. And this is one of the extremely common reason why there is a whole lot of conflicts that come up actually in relationship. One important point is actually the emotionality. So difficult for the man to do. And women expect that, in fact, he has no feelings, he doesn't express emotions, he doesn't share anything with me, or some of the very typical stories which actually we are encountered. Men actually almost always like statues. There are a few more other brain mechanisms which have been documented. Women use more words than actually man, and in fact, this is one of the most irritating thing for them. How was the day means actually man can express something like good or bad and nothing more than that. But a woman can actually, in fact, can go on about essay type of writing. Seeing. Women actually feel men are really blind. Even something very simple, if it is there, he can't pick it up like that. Men cannot multitask. I'll come to that 1 or 2 minutes later. But when they use the word that I want a brinjal color saree, what she is actually telling, this is one of the things actually he has gone to the market to find what is the brinjal color. So difficult for the men to actually understand. Man's vision is narrow and very far he can look into. But woman, it is a sweeping, and this is one of the reasons why, in fact, any danger or in fact, there is a girl coming far, in fact, his antenna raises, but actually, as far as the woman is concerned, her way of interpreting things are different. Later, some questions come in, so we'll try to answer some of these things. When you are trying to talk about other specialized organs, say hearing, men are actually deficit in 25 to 30% compared to women. And this is one of the reasons why a woman says there are about 10 things for him to actually do. You might have heard only about 1 or 2 small items. And when we are talking about relationship therapies, marital therapy, many of the times we tell women actually how actually to go about. See, for example, this is one of the very intelligent woman. She wanted husband to go to the market and bring tomato, how it should be, onion, methi, potato, bhindi, mirchi, palak. See, it solves the problem. Rather than you getting upset that this particular fellow couldn't remember he remembered only 2 or 3 items of what 10 items what you had told. Rather than getting upset, it is better you solve it yourself. Inhibited female drive, because men actually believe sex means actually it is like this may be one of the reasons why the term screwing came. It is like nut bolt and phenomenon. And hormones produce a whole lot of issues. I don't have much time to talk on these things because each one can be one of the major presentations. One important thing is actually the estrogen, Marilyn Monroe. In fact, this is one of the receptive, passive, in fact, active in the sense that, in fact, compared to what we basically call testosterone, this has a very different types of effect. Sexual signal, picking up. In fact, a man's way of picking up is something totally different. That may be one of the reasons why they use a lot of scents and a whole lot of things to attract the man. This may be the thing what Easter cycle and lot many things what we talk about are attributed to this particular fact. Whole female sexuality revolves around what we call as oxytocin. This is extremely important. I'll come to this because when we try to talk about therapy, having some idea related to this particular aspect is extremely important. Molecule of love. A girl is refusing to come near. In fact, feed her plenty of chocolates. She will be yours. This is one of the statement, inverted comma, people have made. This is related to the release of this particular phenylethylamine. Progesterone, natural sex offender drug, plenty. prolactin, inhibitory, hormone of nursing, present in plenty. Monogamy molecule, what we talk about. In fact, compared to man, the issues are something totally different. This is one of the reasons even the DNA and other worlds. In fact, people have done studies, even that about 20% of the worlds which are actually monogamous. This is because attributed to the vasopressin chain, whether small or long. And in case of man, it is modern brand of war hormone and being aggressive, seeking partner, and actually, in fact, going about their approach is actually something totally different. And what it actually we are trying to convey the message here is we have to deal with female sexuality in a totally different fashion. And it is extremely important because from therapy point of view, desire personified and sex addiction, lot many things what we talk about. In fact, for all practical purposes, it was attributed to the male sex to a great extent. In fact, the literature is full of many such examples. And when we are trying to talk about serotonin and few more other things, in fact, they're all indicators that, as the WHO classification very clearly mentions, as far as sexuality area is concerned, keeping in mind axis 1, the sexual problem for which she has presented, and comorbid state. Depression is one of the extremely common things which can interfere in a significant way. Relationship matters. In fact, love first, sex next, sex first, love next. In fact, these are the two different themes under which actually the man and woman actually function. And one of the most important things is actually when we are trying to talk about orgasm in case of female, now the literature speaks about oxytocin and its role. All the other things we have just very briefly we have mentioned. See, women also feel like looking at men, seeking partner possible, because whatever little testosterone which is present, that is responsible for that. This oxytocin acts like a multifaceted role in attraction, touch, mating, sex, orgasm, bonding, labor, parenting, nursing, you name. In fact, majority of these type of things which are attributed to the female sex. The initial romantic encounters are almost like current touch. In fact, the reason is attributed to this oxytocin effect. But tolerance also develops so fast. And this is one of the reasons. In fact, many people immediately after marriage, the things literally change. The 7 pharas of the marriage itself can knock off that particular excitement. And this is one of the reasons why many women complaining, he was so much after me. And after marriage, things have totally changed. The picture is attributed to this fact. And now add to that, the laptops, mobiles, in fact, the TV channels, and many of these type of things have robbed, in fact, the females what they are actually seeking. So when the cure is a cuddle, in fact, this is one of the statement made, extremely important because all sensate and such other therapies depend on this particular process. So there is a difference between what we basically call happiness and pleasure. And many of these type of things, which are actually so well documented in case of male, there is some issue related to this in case of female. And what we talk about is, in fact, if a man is able to handle his wife like a girlfriend, in fact, these are the extremely important things which actually works on. Many people, in fact, women are made to work for, in fact, she was in a job removed from there, and many of these type of things can lead to quite a bit of difficulty as far as their, in fact, thinking about what is my life and what I am actually doing, whether it is the right thing to do and all of that. So a good combination of dopamine, oxytocin, serotonin, endorphins, this is what actually works out best. How this can be done? In fact, we have given very briefly each of the issues which can actually keep the woman actually fresh and active. And many of the times, there are a few more issues which actually we need to look into, the developmental issues. We are all psychologists aware of certain theories and all that. Basically, when we are trying to talk about anatomical development and growth, it has been documented that we all started our life as females. But Freud very clearly mentioned that it is actually something missing. This actually, the deficit is actually carried forward much of their life, and this actually leads to quite a bit of difficulty. And when we are around somewhere adolescents, there is a significant change that happens, and this is the neurochemistry, the hormones which evoke sometimes. In fact, they're all growth drivers which can bring about remarkable changes. Some are able to do well, some may find it difficult, and some may land up in trouble. Whole lot of permutation combinations are possible. And this is what actually the Kinsey's figure. This is from comprehensive textbook of psychiatry. What it says is, see, when we are trying to talk about reaching menarche, puberty, about maybe 2 years earlier than what we basically call boys. Boys reach puberty maybe about little late, about 1 year, 2 years, 3 years late. But their interest and sexual activity is about 3 to 5 times more common than actually the female. It actually somehow comes around 35 years, which matches. And all through the life, it can be there. This is one of the reasons why, in fact, we hear sometimes boy telling, I'm in love with a girl, I came to know she's 2 years older to me, what shall I do? In fact, this may be one of the best combination what one can think. Because we have already depicted in the earlier picture, the libido, there is actually some change, where actually this can match. In fact, a woman 2 or 4 years older than man is one of the best sexual combination one can think of. On the similar line, if we try to look at as we age somewhere around 40, 50s, the relative decrease in inhibitory female hormones, relative increase in testosterone, there is a significant increase in sexual desire and activities in case of woman. But in case of man, the story runs exactly differently because one is aging, one is maybe alcohol, drugs, and other related things, a whole range of metabolic syndromes. They actually play havoc with his sexual life. This is where, in fact, couple six divorce after 48 years, 20 years, 30 years of married life, and now they are talking about divorce because there's a wide change. All said and done, we have done actually certain studies related to what actually happens as far as the female sexuality. Following hysterectomy and somewhere around 40, 50s, the woman not showing interest in sexual activity is one of the major common complaints from many men. This is attributed to primarily predominantly the psychosocial aspects rather than to what we basically call the sexual aspects. And menstrual cycle, if you try to look at, there are two peaks. One is actually with the onset of menses, the woman is actually at peak of her sexual arousal, and somewhere around the mid-cycle, the ovulation time. This may be the nature's way of designing one for the pleasure and one for the actually what called reproduction. And what we basically call somewhere premenstrually, they are the least sexually arousable, and this may be one of the common reasons why a lot of difficulties actually women go through, and which has been referred to as premenstrual tension syndrome and such other things. There are a few other behavioral issues very briefly we'll touch upon. One is actually she can multitask. Men find it very difficult to multitask. In fact, he can write many memos and all like that, but all said and done, to do what actually a woman can do, it is actually something very difficult for a man to do that particular thing. Boys are the weaker sex, and women are the stronger sex, biologically, psychologically, socially. I won't spend too much of time there, except that, see, X sperm and Y sperm. Y sperm is a very weak one. Natural pregnancy, if you are trying to talk about, 70% of the time it is actually female, not because of anything, because the X can survive for about 5 days. So there is a higher chances of the female child. Artificially, in fact, abortion, lot many things. This is why the whole range of what we call sex ratio changes that have come in this SARC and some of our countries. Somewhere it was believed that women are weak because they weep for small, small things. But unfortunately, this is their, not unfortunately, it is their strength. What it means is, because they are able to express emotions, in fact, they can work out things better, they can manage stress much better fashion. And this may be one of the reasons why God intended that the stronger sex should go through a whole lot of difficulties. That's why the menstruation, pregnancy, rearing the babies, all these other responsibilities have been given to the females. So these are a few of the things. She can multitask. And they are burdened with, this is one of the great advantage what they have. And unfortunately, they are burdened with so many things. I very clearly remember one of the very patient recently what I had. They are husband and wife, software engineers, and they travel from Mysore to Bangalore. Every day she goes there in the morning. She has to get up early and she has to prepare breakfast and keep something ready for the in-laws. She comes back around 7:30, 8 o'clock, and after that she has to prepare food for night. so exhausted. In fact, here the treatment is appointing a maid who can take care of some of the responsibilities. It is not that she is not capable of experiencing sex and some major physical problem has happened. So one of the most important point is actually keeping the drudgery out and giving her a little free time is one of the extremely important, and the therapy should focus on this particular point. Neglecting it and you are trying to do certain things, in fact, it is not going to be successful at all. This is one of the advertisement of Century Beds, which says that you sleep on this bed, you will get sleep. In fact, people say happily married, but many women feel that, in fact, they're still sleeping with their enemies rather than with actually. What Uli Allen mentioned, love is the answer, but while you are waiting for the answer, sex raises some pretty good questions. But exactly opposite is also true. And that whole issue is related to the relationship. Love, intimacy, sensuality, these are all extremely important components in case of female sexuality. See, when you give drug, brings about erection, ejaculation, or a man reaches orgasm, why actually the problem? What is the problem? Unfortunately, what was actually recognized was women were not happy with this pure physical process. What was missing was actually this seventh component, what Levin mentions, that emotional satisfaction, what is called personal reflection. Those who have positive regard, they actually seek sex. Positive attitude, frequent sex, it actually leads to. Negative regard leads to personal inhibition, hostile and critical attitudes, and limited sex. And this was the story about the female sexuality. Unless the man understands this whole issue, he is likely to land up with quite a bit of difficulty as far as the sexuality is concerned. And when you are trying to talk about intimacy, there are a lot of issues are there. I will not go into the details. Attachment style, family dynamics, identity issues, self-esteem. But the important point is, if both of them like each other, the therapy becomes easy. We have come across families where, in fact, they are not in talking terms. He is sleeping in a different room. She has gone off to some her parents' house. In fact, these are the people actually we find it much more difficult handling and dealing with these problems. In the similar line, sensuality. Why I am actually using this particular word is very. Sometime back we had a case. Husband's complaint was that, sir, she doesn't take bath every day. She doesn't dress well. She will be always in the 90s. I am put off. When this issue came for discussion, the wife's comment was, sir, please tell him I am actually his wife, not his girlfriend. What it means is, because I am married, I can just forget about, neglect myself. It doesn't work. In fact, the activation of senses is one of the extremely important component necessary for sexual arousal. And when you are trying to talk about sensuality, there are a lot of things. Taking baths, noticing breeze against one's face, having massage, listening to music, lighting candles, getting one's hair done. This is one of the reasons why there are plenty of stories available which talks about man looks at problem in a different fashion compared to woman. They seek this whole range of romantic and sensitive situations, which actually man may find it difficult actually to provide. This may induce sexual excitement, but the idea here not intercourse or climax. In fact, this is one of the process which is absolutely necessary for from woman's point of view. And sexual response, when we are trying to talk about, there are certain things between man and woman which are actually different. Seeking actually the sex in both the sex, it is possible. But when we are trying to talk about female sexuality, one or two small important differences one should note. Man almost like incandescent bulb when it comes to sex. He can get aroused very fast. He can ejaculate fast. And there is a period called refractory period. Woman has been compared to stream in history. Put the plug on, it takes its own sweet time to heat up. And unless to reach that, there's a whole lot of processes are involved. This is what actually from Marshall and Johnson's and then subsequent elaboration, the man can be very fast. He can ejaculate very fast. This has been documented. But as far as the woman is concerned, it is a process. It takes time. Once she is aroused, she can be multi-orgasmic. And females can experience multiple orgasms. And also, passively, they may actually participate without reaching orgasm. Both the things are possible. So, there's a wide difference between what actually we talk about man and woman. And this is one of the reasons why, say for example, if you look at DSM-5, they have clubbed together sexual interest and arousal disorder in case of females compared to the man, which is actually has been separately kept. This is because it is very difficult to make out what is the desire component, what is the arousal component in case of females, and both of them have been put together. There is a second category earlier used to be, in fact, dyspareunia, vaginismus, like that. Now, in that technical term, genitopelvic pain and penetration disorder. They have removed sexual aversion disorder. Now it has been kept under what we call as one of the phobic disorders. And in case of male, hypoactive, delayed ejaculation, or premature ejaculation, all these things. When we are trying to talk about man and woman, this is actually one unit. If he is able to have sex once a month and she's happy with once a month sex, in fact, there is no problem at all. She wants more and he can perform less. Or he wants more and she cannot cooperate. That's where actually the difference comes. I'll not go into gender dysphoria and other area paraphilias because they are totally different. And now the David Reed's erotic stimulus pathway, it mentions what we spoke about. Marston Johnson's phase says related to the fact that they are purely physiological steps. When we are trying to talk about female sexuality, there are a lot of things which are other than that. Seduction, sensation, surrender, reflection, these are the terms given to indicate, psychologically speaking, there are a few more extra other things which are actually, which really matter. And feeling sexy and other related things, receptivity. Next slide, I'll focus because this gives me a much more clear picture. The Basson's, what we call circular model, talks about there could be multiple blocks possible for a woman at multiple points. She would be worried about setting the roof right to, in fact, the child's bag, which is not ready. So many of these type of things may knock off her what we call spontaneity related to the sexual functioning. So this is what, how would you like if someone turned you on and then left? They need time. And to keep a woman happy, for a man, anything female alive and moving is more than sufficient. But to make a woman happy, there are a lot of things which are actually necessary. One should almost always keep it in mind. And this is from Clinics of North America, which talks about, see, almost with fantasy alone, only about around 5% of the women can reach orgasm. With intercourse situations, somewhere around 25 to 32%. With what we basically call with vibrator stimulation, almost 100% it is possible. That's why now the terminology, the pre-orgasmic state, what actually given for frigidity and the earlier one, that the what is important is, in fact, that what we basically call the touch and whole range of female sexuality therapies. When we are trying to talk about the therapies, what actually have been mentioned is the sunset focus and lot many things. They have a very definitive idea related to this because drugs alone doesn't matter as far as female sexuality and issues are concerned. Few more important points actually to look at. How actually this, in fact, therapy that can be found. In fact, again and again, I'm emphasizing. One of the most important points is actually the masturbation. In case of man, it is almost 98% and only 2% which are actually reported negative is actually they're telling lies. As far as the women are concerned, the figures for the West around 60, 70% and all that. When we did a study on female sexuality of about 500 plus women who were from the elite group, of course, they were wives of Lions, Rotary and such other clubs. What was actually found was only around 32% of the women reported masturbating sometime and only 12% were reasonably comfortable. What it means is many women hardly know what is actually the pleasure and in fact, they can reach orgasm and many of these type of things. And this is one of the reasons why, in fact, nowadays, there are not Netflix and lot many things as speaking about the female masturbation and such other things. But somehow this is actually missing in our women. And this is one of the reasons why the female sexuality is actually problematic and lands up with quite a bit of difficulty. Who presents, how they present, when they present, these are all issues And only when something like, say, contraceptive problem, gynecological symptoms, infertility, people actually come. A inhibited woman refusing vaginal examination are in fact presenting a little difficulty, like what actually has been done. Normal couples, ignorant couples, inhibited women, personality problems, and in fact, even among the high achievers, what actually has been found is the sexual problem could be quite significantly being present. When people present traumatic sexual experience, difficulty in sex act, marriage and honeymoon, birth of first or second baby, and certain crisis situations, and all of these things, just to bring to the focus that we have to be actually a little sensitive to this issue and asking one simple question: do you have any sexual questions, concerns to discuss? Can open up the Pandora's box. Chronic fatigue, host of minor discomforts, insisting on repeated evaluations, dramatic intensity of symptoms, seductive behavior, relief from diagnostic procedures, unable to relax during exam, emphasizes or de-emphasizes emotional cause. All of these things indicate there is some problem. In fact, I almost always sometimes quote a word like, this lady is not serviced properly. Multiple somatic complaints, aches, pains, and many other such things actually they present could be actually having a basis related to this. Extremely common. And one of the figures I am very fond of focusing is actually, in fact, unless you look at it very closely, you are likely to miss out how many horses are there present. The same story with the female sexuality. I just run some of these slides extremely fast because all of them actually convey one important point. I'll come to that. What it actually means is, of course, unconsummated marriage. This is one of the points which needs emphasis. I'll come 1 or 2 minutes later. When we did a study in Mysore, overall dysfunction, in fact, almost 38% of the women reported some problem or other related to that. So overall, in fact, if you try to look at the data that is available, 1/3 of the men and half of the female population is having sexual problem. And in psychiatry, we are very fond of writing. See, SSRIs and lot many other drugs can create difficulty. Antipsychotics adds another different dimension. So almost the problems becomes double. There's another area of discussion. We'll wait for that. Who should talk to them? The female should talk to a female therapist only, or to the male, or anybody would be all right. These are some of the discussions which actually happen in many of the presentations what we have made. Absolutely, there is no problem at all because given the choice, the ladies can actually open up and tell about their story in a very significant way. Individual and couple problem, which I mentioned already, unless there is a difference between what we basically call each one, what we call the desire, there could be actually difficulty. What it means is he wants infrequent sex and frequent sex and a woman not cooperative. Many of these type of things can be. Partner presented as normal. One of the very old case, what I remember, in fact, married to a distant cousin's daughter, and she refuses to allow him. And 4 years later, when he told her that I can't wait any longer, I want to marry somebody else, the mother-in-law told him, come next day. He went home, and there was a big hall. They had kept the cart in the center of the hall. This girl was running helter-skelter, and there were about 5 or 6 ladies who caught hold of her and brought to the cart. They told him, now you perform. He opened the zip and he couldn't get the erection, and comment made was, you are actually not a male and why you are making so much of us. He comes running to us telling that, sir, I'm having sexual problem. So unless you spend some time related to history, you are likely to miss out on the whole this thing. So history, and the third most important thing is actually history. We have to spend some time to get 10% of the clients initiate on their own, but 50% if given opportunities. In fact, the data is available. How actually to say it? In fact, whenever you are trying to talk about any sexual problem case, talk to them separately and then combining together, in fact, is one of the extremely important steps. Individual sessions are extremely important, and there is no alternative at all for this. Says domestic violence, substance use, intent to live relationship, infidelities, individual psychopathology, health problems, and individual goals are coupled. In fact, these are the things you have to talk to them separately. extremely important. And many of the men, in fact, have a range of myths and misconceptions. This rule applies to both men and women. In fact, there are about 100 myths and misconceptions reported as far as the women are concerned. We are actually, one can spend some time on that if when separately, when you are talking about myths and other related concepts which are related to the female. But from treatment point of view, we have to establish in the beginning itself dysfunctions or is the relationship problem. Particularly in case of man. He can have sex with a woman, not with another partner, or he can have sex with a partner but not with the wife. This is a relationship problem. It is not sexual dysfunction. Same story, rules applies. So there are a lot of difficulties which have been reported. Partner chooses inconvenient time, inability to relax, attraction to persons other than mate, disinterest, many other such these things. In fact, they all indicate that there is actually some problem issue. How one can evaluate, as I was trying to tell about history, and history. And a proper examination is also necessary because not to miss out on anything important. Evaluate, particularly physical examination is one of the extremely important and one of the collaborative setups wherein there is a gynecologist or other lady doctor who can do the exam works out extremely well. There are a whole lot of validated questionnaires are there. In fact, the list can be sent, or in fact, one of the paper published, what we call as the review article on assessment scale for sexual disorders, a review. There are quite a few scales Dr. Sandeep Grover has evaluated in great detail. It is there in Journal of Psychosexual Health. It is an open access journal. Extremely easy to get it. This was in 2020, volume 2. So please go through. When we are trying to talk about treatment, this Anand's suggestion that there are some people who only need the permission, some people need limited information, some people need specific suggestions, only a small number of people need actually called intensive therapy, can be actually from treatment point of view combined very easily and comfortably. And this is extremely important to keep it in mind. All people who present to you don't need what we call intensive therapy. Brief therapy may be sufficient in quite a few. Intensive therapy is necessary for only a small number of people who are motivated. And I have developed one small way of approach to actually handling these cases. People have ignorance, you correct it by what we call education. People have cultural taboos and myths by permission giving. People have poor communication skills and you correct it by what we call teaching them. And what we basically call there is a particular sexual failure causes there, and whether we can remove it or alter it or modify it. And a small percentage of individual who may carry what we call wrong idea of success, and they go through performance pressure by actually removing it. And one of the treatments suggested is actually the censored focus therapy. When we say sex therapy, in fact, this is not actually meant for guaranteed orgasms. Doesn't teach people to love one another, but teaches showing love by meaningful and pleasurable sexual expression. Success unlikely if a relationship is in problem, or problem of psychopathology in partner, or there is a vested interest to remain dysfunction in. And these are the cases we should never actually make an attempt to correct it. We are not likely to succeed. Do not impose sex therapy. And if somebody doesn't want actually treatment for that. And this is also true that this is much more than actually just writing some medication. And the time will come, there is no choice at all because you have to recognize and treat it properly. So in just what I can say is dysfunction cannot be treated in isolation. Individual is seen in the context of relationship. Best is the approach of biopsychosocial model. Help the couple function optimally. We need to provide basic information on anatomy, physiology, and functionality, eliminating myths and false expectation, removing performance anxiety, and individualizing couple. So what can be done? It is a multifactorial cause, multifaceted treatment. Different people are necessary in the whole process. Extremely important. In fact, this collaborative treatment technique actually has been found to be extremely important. If there is a desire problem, see, many of the times there are few drugs which actually people have documented, but important point is actually how actually the discrepancy between man and woman can be corrected. communicate clearly, differentiate between invitation and demand, and primarily the relationship issues need to be tackled in significant ways. Sexual aversion disorder, it is almost treatment is like what we basically call the management of phobia. When you are talking about female orgasmic dysfunction, now there is nothing like orgasm.
Sorry to interrupt. We are not able to hear you due to a background disturbance.
I think they have to mute all the other people actually.
Okay, sir.
Organize. Please.
Diksha, can you please mute your...
I think
Thank you so much.
host can do that particular thing.
Diksha, can you mute yourself, please?
So, at one time we believed that word frigidity and inhibition or over control in case of women leading to orgasmic difficulty. Now we believe that there is nothing like an orgasmic woman. All women are capable of having orgasms. 70% achieve with concomitant direct clitoral stimulation, and this is where actually the what we call vibrators and so other such as things actually come into the focus. Some strive frantically and some fake it, and these are all relationship issues we need to definitely look into. They are highly vulnerable for guilt, anxiety, conflict inhibitions that need to be attended. What actually I am trying to tell, primary or secondary, lifelong or situational, depending on that, the treatment need to be actually modified for the management of these individuals. So how actually one can go for couple therapy? There is not much time for that, but all said and done, the brief idea is rule out organic problem and comorbidities, establish ground rules. Whatever you say, so for example, initially we tell them to prescribe sex, that means stop sex. This instruction has to come from the doctor. In fact, a wife telling husband or husband telling wife, in fact, can create quite a bit of difficulty. Being an intimate team. In fact, many men come, I don't want to bring my wife, I don't want to tell her. She already knows, and many women, particularly in this particular part of the world, women are extraordinarily tolerant and they don't want to hurt man in a significant way. So it is a team. That means unit what we have to keep it in for calculation. Relationship, what we see in the drawing room is actually different from what is actually might be happening in the bedroom. Focus on education, extremely important, because what I try to do, in fact, unconsummated marriage is one of the slides what we had focused there. Some of these type of people who are having unconsummated marriage of about, say, a few years, more particularly 5 years, 10 years, treating by outpatient, I have found it very difficult. It is almost like, in fact, they have to be motivated and they have to dedicate certain time actually to learn a lot of things. So keeping them in the hospital for about 2 weeks to 3 weeks, in fact, we can do all the therapies day-to-day basis and in fact, can bring about a remarkable change. We are trying to work on what we are doing and what are the advantages related to this. Reduce performance anxiety, that is by prescribing sex. Focus on comfort, pleasure, and eroticism. Sexual intimacy skill building, in fact, the whole lot of processes which come along with that. And very briefly to put it, I'll try to talk about sensate focus. There are multiple steps people say. Sensate focus without genital contact, with genital contact, in fact, mutual, then genital contact with simultaneous caresses, vaginal containment with movement. In fact, female superior's position as one of the extremely important step. In fact, all of these type of things. One need to learn these things. There was one small video which was there.
I use sensate focus often to teach couples how to re-experience sex for the first time. So what's sensate focus? Basically, it's a massage exercise where two of you are in different positions. So one of you is the massager and one of you is the massagee, meaning you're being massaged. And what you do is you touch each other non-sexually, so no boobs, no butt, no breasts, no vaginas, no penises. You really focus on the non-sexual organs. And what you do when you're the toucher is you focus on temperature, texture, or pressure. How do you focus on temperature? Well, One thing you do is when you're touching your partner, you might notice parts of their body that are warmer or parts that are cooler. That's focusing on temperature. If you're focusing on texture, you notice the parts that are smoother versus the parts that are more rough. Elbow's kind of rough, see? And if you're focusing on pressure, you pay attention to how you can touch in different ways and feel pressure in unique new ways. Like, do you like to give a firm pressure? Or do you like a soft pressure? Do you like pressure more in different parts of your body? Here's the key. When you are in the toucher role, you are touching for your own pleasure, to enjoy those aspects of your partner's body. You're not necessarily trying to touch your partner for their pleasure. Now, in the touchy role, though, we don't want you to get hurt or feel uncomfortable, right? So when you're being touched, you have a couple jobs. One is to communicate to your partner if they do anything that's like irritating or painful. Say, hey, can you move out of that general location for a bit? And using a good communication skill is helpful. So like guide your partner a little bit towards something rather than away. So like say they've been rubbing one area for too long and it's just irritating a little bit. You can say, hey, why don't you move off that maybe to my stomach? Or why don't you use a firmer pressure there rather than a soft pressure? Either way, you're guiding them towards what might make it feel a little better for you. But then other than that, you really just enjoy being touched. And the way to do it is you take at least 10 minutes each to be in each role. So you get a chance to explore touch in different ways. And another thing that makes this kind of fun is you get to explore trying new styles of touch. So you can touch with your fingers, you can touch with your fingertips, you can touch with your fingernails, you can touch with the back of your hand, the front of your hand, you can touch with your elbow, your face, your nose, your hair. Part of this is really just a creative exploration. Like, how many different ways can I touch my partner and enjoy this? Some people suggest that sensate focus be done without sex at the end. There's different reasons for this, and you can do that if you like. I always let my couples decide what they want to do. If they really, really can't help it and they want to have sex at the end of it, that's fine for me. I do encourage them to sometimes try to do sensate focus without it, because part of the job of this homework assignment is to take pressure off sex. And I think sometimes people are so focused on that end result, like we got to get to sex, that they miss a lot of the stuff that really gets them in the mood for sex. So in many ways, sensate focus is teaching quite a few things. It's teaching you to value some of those precursor things. It also teaches you to be more mindful and present. Another piece that's getting in the way for people with their sex is they're so focused on got to get to the orgasm, got to get to sex, got to do this. And it has to be exactly this way, that you're putting pressure on sex and you're not even enjoying the wonderful steps along the way. And so couples who use sensate focus tend to do best if they do it regularly, and they use it in addition to some other pieces of their sex life. Like you can still have sex outside of sensate focus, or some couples will use sensate focus to just get comfortable touching and being vulnerable with each other again. And then that can start leading them back into sex. So if you've never tried it, I encourage you as a couple to maybe set a goal for yourself of trying sensate focus. I usually encourage my couples to try it daily if they can. If you can't, come up with a reasonable number, but aim high, because we almost never meet the goal. So if you aim low and you get lower than that, you're going to be really disappointed. Thank you.
I still remember one of our postgraduate, when a couple had come, spent about 5-10 minutes time, and he came back, told he completed the sensate focus. Sensate focus doesn't happen that particular way. It is a process, it is a skill, and it takes time for the couple to learn. So do keep it in mind. There is a whole lot of processes are involved. People have tried female Viagra, like say flibanserin, which acts on 5-HT one-year receptors, and bremelanotide, but both of them have not stood the test of time. Later, when somebody asks this question related to this, I'll try to answer. When we are trying to talk about management of female sexual dysfunction, so there are a few things I have just tried to work on. So PDE5 inhibitors, buspirone, and bupropion, some of these drugs people have tried. absolutely necessary in certain cases because improving the mood and lot many other things can bring about remarkable changes. Hormone therapy is necessary, particularly hormone replacement. Indications are there and lot many other things, including androgens. One of the side effects is there, but judicious use of these things can bring about remarkable changes. If somebody is dealing with vaginismus or what we basically call painful sex and such other related things, the dilators and use of vibrators and lot many other things have remarkably changed the whole way how we change. So in conclusion, what one can say is management of female sexual dysfunction, we have to look at what we call lifestyle changes, relaxation, improving body image, exercise, psychotherapy techniques, in fact, sex therapy and couple therapy where necessary, privacy, spare time, novelty, and in certain specific indications, the use of lubricant and moisturizers and pelvic physiotherapy, and in fact, Kegels exercises and lot many other things people have documented. So these are all few of the important steps which actually one can talk about. I was emphasizing again and again in the beginning, and now again I will try to tell you, there is nothing like perfect wife or perfect husband. So we need to work on how best. In fact, that's what actually really matters. Sex is a conversation carried out by another means. If you never try, you will never succeed. In fact, just neglecting whether problem will get solved, it won't. And one of the very important message.
A female is designed by God to receive. And whatever she receives, she incubates, multiplies it, and gives it back to the male. She was built to do that. So whatever you give a woman, she'll receive it, multiply it, and give it back to you. Whatever you give a woman, are you listening, brothers? She'll never give you back what you gave her. She'll multiply it first. She's designed that way. If you give a woman a sperm, you'll never get a sperm back. She'll multiply it, give you a baby. If you give her a house, she'll multiply it, give you a home. If you give her groceries, she'll give you a meal. If you give her frustration, she'll multiply it. Yeah. So, brothers, if you don't like what you are getting, change what you're giving.
Woman is a beautiful melody when the man is a good musician. And there's wonderful man-woman magic. In fact, we need to nurture, and just being ignorant and believing ourselves, actually it is not there, is not going to work in that particular fashion. Intimacy and relationship are cornerstone of what you call the female sexuality, and one should focus on that. IPS has come out with the textbook of sexuality and sexual medicine, and many of the other literature available. If anybody is interested, TSS Rao 19 at gmail.com, we can send you some of the soft copies. If you go to Indian Journal of Psychiatry, the clinical practice guidelines talks about what we basically call sexual dysfunctions, and I am one of the co-author for this particular section, easily available. I think with this, I'm stopping here, and if any questions are there, I'll be more than happy to answer. Thank you very, very much.
Thank you, Dr. Rao. As expected, wonderful presentation. I'll hand over to Dr. Tomar to do the next bit.
Thank you, Dr.
Question
Jha.
and answer and sharing.
Thank you, Dr. Jha. First of all, I must say, Dr. Rao, it was a privilege listening to your talk. It's remarkable how you combined aspects of anthropology, biology, sociology to explain the medical and, of course, the psychiatric aspects of sexuality. Thank you very much. Are there any questions? Let's open the forum for questions.
We'll look into it, sir. We'll look into the question and come back.
Can I then start by asking Dr. Rao an observation, really? You know, sexuality is a very important but a neglected area. we are not taught about this in the medical school. And as doctors, my feeling is that we don't feel very competent asking the questions either. And as a result of this, at least in the subcontinent, we find quacks and faith healers, they have a field day. How can we change it?
In fact, thank you so much. In fact, very pertinent and really topical question. This particular Nepal Association of Psychiatrists conducting this program itself is one of the important change that has come. Now we are talking about it. Now we are realizing that there is a whole lot of, in fact, half of the population of the world being neglected. They are aware of their rights, they are demanding it, and they actually expect people to respond to it properly. Ignorance is actually bliss, doesn't work in this particular case, and much of the problems are related to that particular fact that one is patriarchal society, male dominance, whether a woman is having problem or not. In fact, it was neglected all through. With all this also, in fact, let me tell you, we're having sexual medicine clinic. We run, in fact, in India, JSS Academy of Higher Education and Research, we have started program called Fellowship in Psychosexual Medicine. Earlier certificate course was also there. Now we have Diploma in Psychosexual Medicine. Reed Powell was one of our earlier candidate. I can see his photo here. He is there. And at least there are about 10 to 12 people I can see straight away who are all being trained. Approximately around 300 psychiatrists have been trained. And for this year's batch, we have from Nepal, totally, I think, if I remember right, 5 people who will be getting admitted, and we'll be starting the program by this month end. What it actually means is, now there is a realization and things are changing. Only education, and that is the only thing what actually can bring about change.
Thank you very much, Dr. Rao. Dr. Jha, over to you.
I'm not sure how much time we have left because we have already done more than an hour. So I'm a bit restricted. Dr. Nirmal, do you have a couple of pertinent questions for Dr. Rao? Do you have time for that?
Ravi is looking into it, sir. He'll come.
Okay, while he's coming back, Dr. Rao, can I just ask you a question? we both, Dr. Tomar and I, work in the NHS in the UK. Our patients, average patient who come to NHS do not get this service, psychosexual aspect. If they are able to pay, of course, there are private clinics. In India, is it also restricted to just a private, or is there any state level, government level service available?
See, as far as Indian context is concerned, there are government hospitals and there are private hospitals. But all said and done, the social security, which takes care of the care of the patients and all, this is almost a new concept to the society. In fact, somebody develops problem and somebody has to take pay and get the treatment. Government hospitals free, but they are so busy that this area is totally not attended. And even among private psychiatry, see, I have one of the colleague in Mysore. He's a senior psychiatrist. If anybody mentions about anything sexual, he immediately says, there is Dr. Rao, please go there. Because he says, I don't find easy spending more than 5 minutes with the patients. He's very comfortable about mania, depression, or maybe something like schizophrenia. I can prescribe medicines, I can send. They eat my head out. No, you got the point. We have to be psychologically prepared to sit, to listen, and unless you make them comfortable, it is not possible.
But just a follow-up question on that. Is psychosexual medicine, is it really psychiatry, or is it a different branch of medicine or psychology?
See, if you try to look at ICD-10, sexual medicine is there in psychiatry. At one time, we believed that psychiatry has a significant role to play, and this is the branch which has to be dealt in that particular section. At one time, we believed almost 90% of the sexual problems are psychological problems. It is the mind problem. But then, see, the reports started coming from diabetic clinic, urology clinic, endocrinology clinics. Almost about 90% of the people have one or other specific problem, and that need to be attended. Now, we don't believe anything like purely psychological, purely biological. It is almost a combination of bio-psychosocial model. That's what actually we were trying to talk about. Now, you look at ICD level. Now, it has separated it and it has kept it in a separate place. They have a justification to keep this particular thing. One is to remove it from psychiatry because everybody believes that it is a psychiatric problem. It is not so, like that way. That's what actually they believe. And everybody has something to contribute. So if it kept separately, and then only everybody will get involved and things can happen. So now we have a separate section altogether for this. I'll give you another example of one of the ad board program, one of the pharmaceutical company I was attending about 3 months ago. There were about 20 plus consultants, and I was psychiatrist. There were other two psychiatrists, but almost 85% were non-psychiatrists. They were talking about management of male erectile dysfunction, PDE5 inhibitors, more particularly sildenafil citrate, how it can work wonders, and a whole lot of these things. Then when we were trying to talk about something related to the relationship and so many issues, everybody was pouncing on us, telling that where on earth you have that amount of time, how actually it will pay you back. Now you got the point. Everybody calculates in terms of money, time spent, and a whole lot of these things, which actually creates quite a bit of difficulty. There is nothing like I don't have time. You have to make some time. You have to listen to them, and to very simple way you deal it, or a little complicated case, whether you yourself will deal with, whether another friend can deal this particular problem. We all have to be actually awakened for this particular fact. This is
Thank you. I'm sure Nepal Psychiatric Associations can organize another event to debate this very topical issue. Dr. Rabi, are you ready for the question, or should we open this for anybody else to ask?
Yes, sir.
Directly.
I was just going through the chat there. I found two questions. So
Okay.
I'll put it to Dr. TSS Rao. So what the question is from Dr. Madhur Basnet, and he's asked, if hippocampus is better in females and memory long lasting, why is dementia more common in females?
See, the point is, when you are trying to talk about organic problems and lot many things, dementia is more common in females. I don't think it is a very justifiable, very scientific observation. There are a lot of controversies related to that particular aspect. But when we are trying to talk about a normal average individual, anybody married person will understand what precisely can happen. I'll tell you one classic example which I was dealing. They got married, and one of the complaints from the wife was the muhurtam sari which was given to her was not of good quality. She was telling 3 months later, this muhurtam sari what you provided, it was not of good quality. 1 year later, she was still complaining that muhurtam sari what you gave, no, it was not of good quality. 10 years later, she was telling that muhurtam sari, even my relatives talk about it even today, about that particular point. 25 years after marriage. In fact, one of the reason he was quoting, there were a lot of saris and she wanted to give it to some ashram. And at the end of that particular process, over about a few months, the saris, why you have not given this? Her only comment was to remind you. No, you got the point. What I'm trying to convey message is, there are few things, both good and bad, and more particularly a bad one, we retain it for a long time. Very recently, I had a lady.
Dr. On this particular question about the female and dementia, both Dr. Tomar and I are older psychiatrists. We deal with dementia all the time. Just a correction that vascular dementia actually is more common in males in Indian subcontinents and Asians in the UK. So hippocampus is affected, but it's something to do with the aging rather than sexuality. So in fact, in dementia, the problem we deal with sometimes is that the disinhibition. Both males and females become so disinhibited that in the ward, they start changing each other. So instead of encouraging them, we have to inhibit them. So that is a different topic. We'll discuss that. Thank you very much. You had another question, Dr. Rabi?
Yes, there's one more question. It comes from Dr. Versa. So she's asked, what is the comparative ratio or percentage of lack of male to female sexual desire?
See, what we basically call lack of sexual desire is classically and clearly recognized in case of males. How actually one can go about, say, for example, the tingling sensation, masturbation, frequency of sex, going about searching for partner, and many of these type of things indicate the desire component, and it is very easy. As far as the females are concerned, it was actually happening very difficult. This is one of the reasons why, see, interest and arousal disorder now has been combined together and has been put. Because, see, in case of man, something is apparent and very easily, classically, we can either rate it or conclude in some particular fashion. As far as the female is concerned, everything is hidden. What is arousal? What is actually, in fact, part of the desire is so difficult. That's why the current research is running. DSM-5 at least has gone one step ahead, and now they have put everything together, and this is what actually they are telling. So, as far as the female concerned, that's what my whole lecture was related to, the inhibitory female sexuality, and desire disorders are extremely common. Reasons are many. One is starting from biology, psychology, sociology, all parameters if you try to take. The sex is actually one of the things almost one has to do like a duty. A lot of problems are associated with that, and they are not happy with many of the partners, and the boredom that actually comes along with that, and a lot many other, what we call, starting from socio-culture related aspects. Sex has become something purely secondary in many women's life. Exact figures are not available and very difficult to reach that particular conclusion also. But consistently, the female libidos at a lower level and problems associated with that are extremely common is well documented.
Thank you very much, Dr. Rao. It was excellent presentation. I still think that your live face-to-face presentation is much better, but even on Zoom, it was of that quality and profound impact. So thank you very much. Do you want to say anything yourself before you conclude?
I'm extremely happy that this particular topic was chosen. I was invited. It is actually a great pleasure to be with. And I'm really lucky that I'm meeting though in the Zoom platform, that we are learning each other. And my idea is that each of these SAARC countries in particular, this has to take up in a little seriously. And see, many of the times the theory is very easy. Learning skills is actually something very important. This is what actually puts off a lot of people. Say, when I say censored focus, it is not something which anybody can do it in a very simple way. How actually to approach, how actually to go about, and many other such processes are involved. So India has taken a big step in the sense, of course, for such a big 140 plus billion population, there is only one center which is actually university-based training program. There are a few more training programs which are available in West. People go there and get trained. Very costly affair it is. So we have to take up this particular thing seriously, and I think Nepali Psychiatric Society also takes up this particular issue in a very big way. Thank you very much for this wonderful opportunity.
I will hand over to the Psychiatric Association of Nepal to say anything before we close.
Thank you to all of you. So, to all the participants, our chairman, and the presenter himself. So, this, I think, I don't know if you're able to see this or not. This is a certificate we prepared. I'm sure we'll make sure it comes to you, but before you have it in person, I guess you should accept it in this form as is, in a digital form. To all the chairmans, to both the chairmans, Dr. Rahul, Dr. Arun, and the speaker, Professor Dr. TSS Rao. Thank you for the great presentation, great participation, the discussion. And then I think with this, with the promise to meet again in the next month with the fourth episode of Mindful Wednesday, I think this is all from our side. Thank you, everyone.
Thank you very much.
Thank you, Nirmal and the team and the Torrent for, in fact, and taking up this particular thing. Thank you so much.